In a leaked letter circulating online, Ontario's top doctor says he's concerned that stricter measures in Niagara Region schools will harm children. The memo is addressed to Niagara's Medical Officer of Health, Dr. Mustafa Hirji, and criticizes his decision to implement additional protocols at local schools. As Kelly Botello tells us, Dr. Kieran Moore says he wants consistency across the province.
This leaked letter outlines all the reasons Ontario's Chief Medical Officer of Health doesn't agree with Niagara Region's top doctor when it comes to adding measures to schools locally that are not required by the province. CHCH News asked Dr. Kieran Moore about it today.
What I'm trying to have across Ontario is a consistent and persistent approach.
Moore's letter comes after Niagara Public Health, headed by Dr. Mustafa Hirji, sent out a note to the school community in the region saying that additional measures would be implemented for in-person learning, measures above what the letter calls the provincial baseline. The additional protocols include having classes isolate if one student tests positive and sending all of them home for 7 days instead of the provincial guideline of 5 days. The rule wouldn't apply to fully vaccinated students, but Niagara Public Health says parents would be made aware of positive cases.
And some of the recommendations that he had put in play could have increased the amount of absenteeism of students, so it seemed to go contrary to the recommendations of the science table.
In his letter to Dr. Hirji, Dr. Kieran Moore signs off by saying, "I am concerned that these measures will lead to increased harms to the children and youth in the Niagara region, and I strongly urge you to reconsider your approach in alignment with provincial direction." But NDP leader Andrea Horvath says the province should be supporting local health units.
I think it's shameful. I'm going to be straight up. Public health units and leadership have been the ones that have stepped into the breach as this Ford government has abdicated its responsibility.
Horvath says it's not fair to let public health units decide what's best for their region and then criticize their actions.
And then turn around and say, but we don't agree with the decisions you've made.
Dr. Hirji was not available for an interview today, but in a statement to CHCH News, he says he appreciates Dr. Moore's feedback, but will be proceeding with the additional measures to successfully resume in-person learning. Kelly Botello, CHCH News.